of us in order to be able to serve our population. The maximum is double that amount. We need to have at least 960,000 units per year. There is need to surpass the minimum and approach the maximum requirement. Our target should be at least, if we don't get to the 960, we should at least get to the 720,000 units. So a critical review of blood situation in Kenya shows that there is a huge gap that we have. And to ensure that we can respond to our patients, we need to address this issue with the utmost seriousness that we can garner. The 2010 Constitution changed the narrative for most of our blood institutions, including this sector and other sectors that we manage within the ministry. Article 10, on national values, places new demands on good governance, integrity, transparency, accountability, and human dignity as a whole. And I think that when people are dying away because we don't have enough blood for them, that to me is abuse of Article 10. And I'm glad to note that the Kenya National Blood Transfusion Service Bill has undergone the first reading and has since been committed to the Departmental Committee on Health for consideration. We appreciate the role that Parliament is playing in this regard. I therefore want to take this opportunity to ask members of the public to submit their views to the committee to enable us to come up with a solid law that is going to exist in perpetuity. I also want to pick out the importance of leveraging modern ICT. We must use ICT to maximize our efficiency within the activities that we want to undertake. If we do so, and if we predicate what we are going to do on good management, good governance, provision of ICT, then we should be able to cast the net wider on donors to net the 70% of our target population at the ages of between 18 and 65 in a very short time. We should create a clean register of donors with which to enable us to know who our regular supporters are. We should incentivize our blood donors through modern forms of recognition and appreciation, including, and I have proposed this before, branding, levelizing, so that people know what level of blood donor they belong to. We should be able, again, leveraging on ICT, to track blood from point of donation to the point of utilization. We should be able to monitor our blood supply levels, complete with the requisite alerts to deficiency and all oversupply. We should be able to manage supplies in relation to needs, including the need to distribute blood between hospitals and counties. The responsibility, therefore, Mr. Chairman, is on you now to define the systems that will catapult blood transfusion services in Kenya to be responsive to modern needs and demands. I therefore take this opportunity to congratulate you, congratulate the team, congratulate those of you who have been given this opportunity, and wish you the best of luck in this undertaking. You have our support. I believe you have the support of all Kenyans, and particularly you have the full support of His Excellency the President, and he was quite happy and glad to hear about this team, and hopefully we will be able to address our concerns in the fastest possible time. Let me just add the following, that moving forward as a ministry and in terms of management of blood, we do not want to see duplication of activities. We are going to centralize all blood activities into one, and there will be no other activities taking place outside the ambit of this institutional framework. And anything that is currently going on will be brought to this framework so that we know the right hand must know what the left hand is doing. Anything involving the storage, anything involving the search for, anything involving the management of must now be brought squarely into the ambit of the institutional framework that we have built. Before I ask the peers to make remarks and give a vote of thanks, I also want to, for purposes of this meeting, to say that these reforms that we are making, and particularly the issue of blood, as I said earlier, is part of the wider agenda. And as we begin, as we are so involved in the issue of the management of COVID-19, I think it is important for us to remember that the rest of the disease system in the country continues. You know, there is a tendency to think that we are now, this ministry is a ministry of COVID-19. It is not the ministry of COVID. You know, even I hear children are calling me Waziri wa Corona. Now, let me make it clear that the ministry's normal activities remain and must continue. And this is the reason why we decided that we must continue with this effort. We must continue with other efforts. We must continue with everything to finish and conclude universal health care. We must continue reforms in all other our institutions so that we can be able to achieve what our ultimate goal is. And as I said from the beginning, our goal is a pleasant engagement between a service provider and a patient. That is what we are trying to create. The long and short of it is that a patient sits here, a provider sits here, and they are both happy. You know, the patient is happy because they have been given everything that they can. The provider is happy because they have been supported to do so. And that's the long and short of it. And as we fight coronavirus, because it is here with us and there is nothing much that we can do to change, I call on each person. I call on all of us. Because even patients, all the patients, all sorts of patients, require your services. And therefore, I call on you and inform you at this point that we now in this country have some 363 positive cases in Kenya, having today confirmed some 8 new cases. And these 8 new cases come equally from Nairobi and Mombasa, because we have got 4 from Mombasa, and you can see now Mombasa is becoming a concern, an area of concern. And we have got the rest of them from Nairobi, and all of them are Kenyans. All of them are Kenyans. Before it used to be people have traveled elsewhere, but these ones are all Kenyans. But we are also happy because through the work of the very diligent health workers, we have now also discharged some 8 people today, bringing the total of those who have recovered to 114, just about a third of the ones that that had become positive. But I also want to take this opportunity also to add that we are also, in addition to everything else that we are doing, trying to play our role as a ministry to see what we can do, what measures we can take, how we can assist the economy to continue going on in spite of everything. We are learning from experiences elsewhere. Countries are opening up much earlier than we think we should. Other countries have delayed, but we want to make our own measures based on our own experiences and based on what we have seen as a people. Yes, as you know, when the president made his remarks, he talked about the reopening of restaurants within certain protocols. And just to share with you some of the things that we will expect that these protocols will involve is that restaurants will operate between 5 and 4 p.m. not later than that, because after that, then it becomes difficult to for the people to get home, just for curfew. But at least within that period, a lot of people were not able to go for lunch. Places near them can be able to do so. There are people who work in those restaurants. They can be able to do so. But of course, for them to do that, we also have asked that those restaurants that are going to open for this purpose must limit the number of persons who are going to be in the restaurant, so that they can be able to keep the social distances that we have recommended. They can be able to keep at least 4 people for 10 square meters. The tables within the dining areas must be spaced at least 1.5 meters apart from each other, and customer sitting must also maintain the social distancing that is required. We must maintain the social distances not just along, but also behind, behind each other. We have also said that this is not a license to start opening pubs. It is not a license to start opening alcohol sale across the country. Alcohol shall only be sold with those having meals in a normal manner in a restaurant. We have not opened bars. Then we have said that when we are in those restaurants, we will not be serving buffet lunches or self-service lunches for obvious reasons. I think anybody will understand that if you are going to go to those restaurants, then there will be no buffet, as we understand it, or self-serving food and people walking around and in the food areas. That cannot happen. Then in terms of the safety within the restaurants, what we expect to see is that, number one, that anybody walking into a restaurant must wash their hands first. They must sanitize themselves. They must have a mask. And more seriously, is that restaurants that are going to open with people who have been tested, who are going to be COVID-free. So if your persons have not been tested, you cannot open a restaurant, because it is very possible then for a person serving there to spread the disease amongst all customers who walk in. And this is from experience. I think some of you know what happened in some of the areas we had quarantine facilities, and some of the people passing the disease, even in those facilities, could very well be those serving the people. So all other measures, running water and what have you, all those measures will be taken to ensure that people are safe in the restaurants. We have also, from an economic, again, to support the economic perspective, the president announced the issue of hygiene workers to clean up all the slum areas, all the populated areas. And this has 2 purposes. One of them is that we are going to keep people working, particularly young people, the youth in those densely populated areas. But even as they work, again, there's a protocol, there's a health protocol, because anybody walking in, we have asked our team, our public health officers, to be part of those teams, to go with thermoguns and ensure that there is nobody walking with a high temperature, even as they clear the garbage areas, to keep distances when they do so, and all other protocols that have been issued by the ministry. This is all in an attempt to make sure that people keep eating, and people can feed their families, even as this situation escalates. Of course, we will, as the president said, escalate or de-escalate these measures depending on how we see the situation going. By the end of the day, as I have repeated many times, the Kenyan situation will unravel itself because of one single factor, and that is our own self-discipline. If we discipline ourselves, and if we take responsibility at an individual level, then it is quite possible that we can begin to defeat this virus. But if we don't do so, then we will continue to have challenges. And these challenges are going to be very expensive in terms of lives, and in terms of the economy. But my hope and prayer is that this is what is going to happen. And I'm glad to say that we have noticed that people have actually begun to adhere to the rules that we are making. And particularly on the hygiene side, what that has done, it has brought down already the cost of healthcare, because cases of diarrhea, cases of stomach problems have gone down dramatically. And we have no doubt that this is because of the hygiene measures that we have taken. So without adding anything more, let me just first invite the PS to say something and move a vote of thanks. And I want to thank all of you most sincerely, and I want to declare that your committee is now active. Thank you.
Yeah, thank you. Thank you very much, Waziri, and to the team that has just been appointed to undertake this task. I just want to, one, congratulate you for that, and secondly, to assure you of our support. You are coming into an environment where it is said that all donor funding was withdrawn. But I want to assure you, even as we sit here, the government itself has committed 1 billion shillings to ensure that the country continues to have blood available. And so for me, it's just to urge Kenyans, even in this COVID situation, really, people need to continue to donate blood. And CS, I really want to thank you, because when you came into the ministry, one of the challenges that we quickly highlighted was the problem of blood. And now we have a team of very able people of diverse skills that are all needed to make sure that we have a sustainable blood availability mechanism in the country. So count on my support as you move along with the work. And we look forward to a transformative change for blood for the people of this country. Thank you very much, Waziri.
Asante sana. Thank you very much. He is a money lady, so keep close. Keep close. I had mentioned earlier when I was speaking that we have been working very, very closely with Parliament, for legislation and for other support. And I'm very, very happy that the Honorable Sabina Chege is here with us. Sabina is, as you know, is the chair of the Health Committee of the National Assembly of Kenya. And I think that because he's a politician, she has to say something. If she doesn't say something, it can be very serious. So, Sabina, I would like to invite you. You wanna pass this, or you wanna come here? Well, why don't you come and speak from this chair? Huh? Life being what it is, one day you might be here as a CS for health. So.
Well, thank you very much, CS, and I just want to welcome the committee. Personally, and my committee have been working on the blood bill, and there's a blood transfusion bill. And maybe one of the quick things that you'll do is have a look at the bill. Let's talk and present new ideas to the committee, because right now we have already done the publication, and so we are a little bit ahead. But you'll catch up, and I want to congratulate the CS and your team for a job well done. I think the issue of blood is one of the issues that has been key and has had a lot of attention with my committee. So I promise to work closely with you and my entire team. Feel free to come and consult. We are the people's representative, and so we are there to help you and also to fast track the bill so that we can have the benefit for all Kenyans. And so thank you, CS, for the opportunity and for wishing me well in the future.
Asanteni sana. Thank you.
Should we actually continue mass a little bit?
Yes.
You want to continue a little bit? Okay, very well. Bharat, all the best.
But we wait.
Thank you.
Yeah, but the meeting is not over. The meeting is not over.
Thank you.
Yes, thank you. Understood.
Thank you. It's just the committee, and then we'll.
Sabina,
Yes.
you want to come with me, or you want to wait for the? You want to participate in the meeting a bit? You want to sit in the meeting?
No, she can come with
Let's
you.
go.
Yeah.